protocol that we use for post-cryoablation imaging is ipsilateral mammogram, ipsilateral ultrasound, and breast MRI performed 6 months post-cryoablation. The main goal is to have the best assessment of the breast anatomy because none of the studies are good enough to exclude the presence of residual malignancy. So we use a combination of three to have an understanding of what remains, but also to provide a foundation or reference point for subsequent imaging. Ultrasound is very good at looking at distortions, and so we typically will see an area of injury that's well circumscribed, but it isn't really good enough to tell you that there isn't residual tumor at the center of that area of cryoablation. So we look for other things. A mammogram will show you an area of density, generally outlining the borders of the ablation zone, but over time what we expect to see is lucency in the center as opposed to a density, which is what was present before the cryoablation was done. And then in the case of breast MRI, we typically see an enhancing rim that has no enhancement near the center or minimal enhancement near the center. Certainly you'd like to see no enhancement where there was previously enhancement corresponding to the site of malignancy. I think that, to some degree that might be over-imaging, but very few people know what a post-cryoablation breast should look like. Certainly most radiologists don't know. And so, building the data set so that we have some experience with looking at breasts at different time points, it's really important. We also recommend a core biopsy at 6 months because, again, none of the studies are really definitive and excluding the presence of residual malignancy. Many patients and certainly many providers have considerable anxiety about examining a post-cryoablation patient because they're concerned that they can't be sure that cancer doesn't remain, especially if they feel a lump. In fact, the lump is generally bigger, so many of them think that the tumor has progressed. But giving them the assurance that there's only fat necrosis or fibrosis corresponding to that mass lowers their anxiety tremendously, which also has a benefit of lowering the patient's anxiety about their clinical findings.